Okay, so welcome all, and my name is Dr. Harman, and I'm an obstetrician and a gynecologist. And we have Vidishri with us, so she is a CAPA certified childbirth educator. So how this session will go is, I will first show you in a pictorial and a videos form, like what is the proper technique of doing a breastfeed, and then Vidishri will tell you in the with the props, so that a proper explanation you get about breastfeeding. And you what you do is, then you go and breastfeed that way and check if the breastfeeding is going well or not. If it is not, just let us know, then we will figure it out and help you out in that way. So let's start. So why is breastfeeding so important? Just few general points. As WHO, UNICEF all recommend breastfeeding. So why is everyone, so mad about breastfeeding, that why baby should be breastfeed and not bottle fed? That is because it is the best source of nutrition. It will reduce the incidence of allergies, asthma, and many other conditions in the baby. And various studies have been done which have shown that the breastfed babies are less likely to suffer from diabetes, eczema, asthma, some childhood cancers, obesity, heart disease, chest infections, and wheezing. So all these are the additional benefits of having a uh, of breastfeeding the baby. Now, apart from that, it also helps in the visual development, like the babies can see properly. It helps in the improving their vision. It improves their IQ levels, so they have a better intelligence. And it also reduces the development of Crohn's disease. So Crohn's disease is a disease which is related to gastrointestinal tract, and it also promotes better mouth formation and helps in straightening up the teeth when they develop, and also reduces blood pressure. Now, apart from that, it's just for the babies, but it will also help you. If you breastfeed your baby regularly, it will reduce the risk of having a breast or an ovarian cancer. It will also reduce type 2 diabetes and high blood pressure in the babies, and high blood pressure in you, and also will help in losing weight which you have gained in your pregnancy. Now, I'm asked many times this question, like how long should we breastfeed? What the guidelines in WHO says, that there should be exclusive breastfeeding for at least first 6 months of baby's life, and after the 6 months, then you can start with the weaning. And along with, when you are introducing the solid foods, you can introduce solid foods as well as breastfeed the baby. So the frequency of breastfeed will decrease after 6 months, but exclusive breastfeed is very important for the first 6 months of baby's life. Now, there are certain cues which baby will give before he starts crying, and you come to know that the baby is hungry, because there is no other way we can come to know that the baby is hungry, because babies can't speak. So before he cries, you can still come to know that the baby is hungry or not. If there are eye movements when he's waking up, then rooting, then hands, so he will start sucking the fingers and put hands in his mouth, then a little bit of wriggling, restlessness will be there. So all these are the feeding cues before he cries. But if all these cues are not picked up, then he will start crying. And it is recommended that you should not leave babies to cry for long periods, as this will increase their stress level and affects the brain also. So bear in mind that once the baby try to pick the cues earlier for the breastfeeding. If they are not picked up, then at least when the baby cries, just as soon as the baby cries, just give him the breast milk or the formula milk, whichever you are giving. Now, there are certain steps which we need to take for the successful breastfeeding, and it is best learned. So, always wash your hands. Just general tips: wash your hands before you start, because just to improve the hygiene and prevent breast infections. And then you should get yourself comfortable by sitting down with your back straight and your lap flat, whichever position you feel yourself you are comfortable. Keep yourself in that position and get a couple of questions around you if you are comfortable with that. You can also try different styles of breastfeeding pillows which are available easily online. But if you don't want that, then you can have you can have the cushions around and then you can breastfeed. So there are various positions of breastfeeding. So this position is called a cradle, sorry, cradle position, but I would not say this is a very good position because she's sitting on sofa and breastfeeding the baby. Ideally she should, sit on the bed with crossed legs and be comfortable herself. So in this position I don't think so she is herself comfortable. But anyways, this is the position, this position is called a cradle position. This position you can adopt. Then this is called a football position. So like this you can put a cushion below baby's head and feed the baby. This is preferred when you had a cesarean section or your stitches are paining. So at that time you can lay yourself at back and then put a cushion underneath the baby, and you can try to breastfeed the baby like this. Then the next position, this is lying down position. So this is also preferred when you had a cesarean section. So Nisha, you can try this position, and in this you can lie down and breastfeed the baby. So this will your stitches will also not hurt this way, and the baby will also be breastfed.
Okay, but in I have to have one question. In this position, uh, like, isn't there a chances of getting the like the baby will get the ear infection?
No. So if you want, like, if you are worried about that, you can, raise baby's head a little bit, I would say,
Okay,
and then do
okay,
like you can keep your arm underneath the baby so that there, if there is a risk of aspiration or any ear
hmm,
infection, that will not happen. But you can do in this try in this position once and see how it goes.
okay, okay, sure,
But
sure,
make sure the head is supported and it's a bit raised, because in this position I think the head should be raised a bit, because
correct.
there is also always a chance of aspiration when the baby is lying down supine. So make sure that doesn't happen
Okay, okay,
and the head
sure.
is a bit raised.
Mm-hmm. Okay,
So the next step is, whatever position you are in, you have to, once you are in a position, then make sure the baby's head, shoulders, and body are in straight line. Now you can see over here, head, body, and shoulders, they all are in straight line. So once you are in a position, make sure this is checked by you, and then the next step what you need to do is. Yeah, then you have to support your breast from underneath. So if you can see over here, so you have to introduce the nipple in such a way in baby's mouth. It should not be introduced straight away. It should be, you should see the root of the nose and the nipple, they should be in a line. Okay, and then when you have position your fingers well back from the areola. So this is the areola. So this is orange in over here, but it is black in color in the breast. So this areola, your fingers should be away from the areola when you are introducing the nipple in baby's mouth. And this chin, the lower part of the chin and the areola, they should be in a line, the lower areola. Okay, and make sure this root of the sorry, the root of the nose and the nipple, they are also in line. So once this is done, then what you need to do, you have to introduce the nipple in such a way that if you see this arrow, so this is the nipple and this is the upper part of the mouth, and see how it is being introduced over here. So you have to introduce in such a way that the nipple goes from root of the nose, then upper part of the lips, and then into the mouth of the baby. So line up baby's nose with your nipple. Okay, the mouth should open wide enough to cover the lower part of the dark areola. So this should be fully covered. And if it doesn't, then you have to brush your nipple across the top to encourage it to open their mouth. Then once this is done, then you have to introduce. So make sure the baby has a good latch. This is very important. Now baby will tilt their head back and the chin will be touched to the breast. Baby should take a large mouthful of breast. So if you see, this whole should go in. I will tell you in the pictures as well. So, and one more important thing is, you may need to support baby's your breast to make sure that you don't obstruct baby's breathing. So just put the hand on the breast so that the baby's nostrils are not obstructed by your breast. Then you're breastfeeding. Now you have introduced the areola into the baby's mouth. Now you have to check whether there is a proper latch or not. So introducing the areola into baby's mouth, all this is called as an attachment or latching. So you have to ensure that you are having a good latch or not. So how you will ensure? So this whole areola, the black portion should be in baby's mouth. So if you see this, the whole areola is in the baby's mouth. You can't see any areola over here. So this is the first point. Then the chin must be pressed into the breast. So this chin is pressed into the breast, if you can see that. Then this is one second point. Then the nostril or the nose should be clear. So this is what I was saying, that your breast should not obstruct baby's nose, because that will cause obstruct the breathing. So this should be clear. Then the bottom lip is outwards. So this bottom lip is outwards, that means the whole areola is in baby's mouth. So this is an indication that the latch is proper. So if you can see over here, the bottom lip is outwards in this one. And suppose if areola is visible, then it should be the top one and not the bottom one. The lower part of the areola should not be visible. The whole areola, the lower areola, that means the lower black portion should be in baby's mouth. And then chin must be pressed against the breast, like over here it is pressed. Now, how do you know that it is a good latch? So it is a good latch if baby's mouth is wide open. Okay, and then baby's tongue is over his lower gum, and baby's lips are curled out like this way. This way, the baby's lips are curled out. That means there is a good latch. And baby's chin touches the breast, like this way. Or this way, chin must be pressed into the breast. So all these factors, or all these things will determine there is a good latch. So once you have attached the baby, then you just check on your own that the lower areola is not seen, and everything is and the lower part of the areola is in baby's mouth, chin is touching your breast, and the lips are curled out. So that means the latch is proper, and then the baby will start sucking milk. Now, the poor latch will be the baby's mouth is not wide open, baby's tongue is behind the lower gum, baby's lips are curled in, and the chin is not touching the breast. So, all these are the signs of poor latch. Now, what happens in poor latches, if you can see this? So, this nipple is introduced in the baby's mouth, but it is only the nipple. He's not sucking the areola. So, all the milk ducts are over here. So, that is why he's not able to take the milk in. And over here, if you see the whole areola, this lower part of the areola, at least everything is in the mouth, and the milk ducts are in the mouth, and the baby is sucking, and all the milk ducts are producing the milk, and it is going out in the baby, going out to the baby. Now, after you have done everything, then you also can you check for swallowing. So if you see this video, see how the baby is sucking milk. Can you see this? So that means he's having a good handful of the breast is in his mouth, the whole areola is in mouth, and he's able to suck properly. So this is the way the baby should suck after that, after the breast is in the mouth. Now, how will you come to know that the baby is getting enough feed or not? So if he is frequently responsive, feeding is there, and then baby's diapers, wet and dirty diapers, will be the best indicator that the baby is feeding well or not. Then if baby settles on the breast and after feeds, then baby is growing and gaining weight. Now, for the first 10 days, baby will lose weight, but after that, the baby will gain weight. So the baby, if the baby is gaining weight, that means the milk, that he's getting the sufficient milk whatever he wants, and baby is alert and responsive and looks well. So these all are the signs that the baby is getting good feed. Now, how do we know that the baby is feeding well? From our diapers. So from on the day one the baby is born, you should look, at least one wet diaper should be there. Then on day two, at least two wet diapers. Then on day 3 to 5, at least 3 to 5. And day 6 and 7, 6 to 8 diapers. This is just a rough idea. It could be more than one also, but it is at least one should be there on day one, minimum. Then soiled diapers and the color of the poo. Now on day 1 to day 2, there will be at least one dirty diaper or greenish black in color. Then day 3 to day 4, at least two dirty diapers, which will be the brown, green, yellowish in color, and it will become loose. And then from day 5 to day 6, two, at least two, and then yellow in color. So this is how it will go on, but it is